If you haven't been feeling like yourself, your hormones may be out of balance, and there is an easy solution. Here to explain is Dr. Russell Bartels from Vitality Bioidentical Hormones. Good morning.
Good morning. It's good to see you again.
You too.
Yep.
You too.
And today we'll be talking about bioidentical hormones.
Right. Who's a good candidate for that?
You know, the candidates are getting broader and broader. A lot of people think of hormone therapy for menopausal women.
Right.
And we really want to break that mindset because there's so many different reasons to use bioidentical hormones that, men and women, even as early as in their 20s, 30s, 40s, 50s, can benefit from bioidentical hormones. So if you're just not feeling optimal, if you're not feeling like you did a couple years ago, if you feel like you're fatigued and just not the same person, or aches and pains, there's so many different reasons other than hot flashes, night sweats, trouble sleeping, like menopausal symptoms.
Is that because men and women just lose their hormones at various ages? You think that it carries you through to your 40s, but not everybody fits
Not
that.
everybody. I mean, it's amazing to find young people, 20, 30, having hormonal imbalances, but it is important for the person listening out there to say, hey, maybe I have a condition that could benefit from hormonal supplementation.
And it's men and women. And how do they take the hormones?
Lots of different ways to take hormones. There's pills, there's creams, there's patches, there's pellets, and we find that the pellet format, I actually have one right here. Okay. It's a little thing here. It's bioidentical. This one is a pretty small pellet there. You can see that. And these go under the skin, and they last about 3 to 4 months.
Oh.
And it's a convenient way of getting your hormones, so you don't have to apply a cream, take a pill. And in fact, the biggest benefit is the efficacy, the safety of them, and how they mimic your own body's production, or how it would have produced those hormones with more steady levels of hormones. And we find that the patients respond a lot better, more effective, safer, fewer side effects. But just for so many indications, whether that's irritable, depression, we're getting patients off their medications for depression. Some of these medications are just covering symptoms, and they're not really getting to the underlying problem.
And people may not think of coming to you for hormones. They may think, they probably try other things first, but it'd be so much easier just because you can check it through blood tests.
We would always want to check hormones, vitamin levels, thyroid levels. We're not just going to focus on, hey, this is the problem for this is the reason that you're having all your problems. We want to get balance in all those areas. But it's important to check those things and get them in the appropriate balance.
And from what I've heard, when you take those pellets, you know when it's been used up. Like, people can really tell.
People say, well, how will I know when it's time to come back? And the answer is, you'll kind of know. What was the reason you came in the beginning? We don't want you to bottom out every time, but you'll kind of learn your triggers for when it's time to come back in for more. For women, 3 to 4 months. For men, 4 to 6 months. And and it could take a few rounds to kind of get an individual patient figured out. But for patients who are on migraine medication, it's not really helping. This is a great answer for those patients as well.
So many things for men and women too. It's not just, as you said, for women over a certain age.
It's not just your grandmother's hormones anymore.
Thank you so much.
You're
Good
welcome.
information out there. So if you would like more on Vitality Bioidentical Hormones, it's super easy. You can go to their website at vitalityhormones.com, or you can call the number on your screen.